The Brain on Autopsy, What We Know. Join Dr. Moores in a haunting yet hopeful journey through Alzheimer's dementia, from Dr. Alois Alzheimer's first case in Frankfurt to the brains of famous musicians and dancers. Discover symptoms, autopsy findings, and how sleep, stress, and diet protect the aging brain. Like, subscribe, and hit the bell for more whispers from the morgue. In the silent halls of the morgue, the brain speaks. Its whispers carry tales of forgotten memories, lost identities, and the relentless march of time. Today, we unravel the mysteries of Alzheimer's dementia through the eyes of history, science, and the delicate folds of the human brain. The earliest cases, a historical glimpse. Our story begins in 1906 in Frankfurt, Germany, where Dr. Alois Alzheimer, born in Marktbreit, Bavaria, first documented the case of Auguste Deter, a woman consumed by paranoia, memory loss, and confusion. Upon her autopsy, he discovered strange tangles and plaques in her brain, marking the first recorded case of what we now call Alzheimer's disease. Famous figures suspected of dementia: philosopher Ralph Waldo Emerson, composer Maurice Ravel, Bolero, and prima ballerina Alicia Markova, whose later performances were haunted by lapses in memory. While Hackman himself has never disclosed a dementia diagnosis, his family history, like many, may hold clues. Alzheimer's spares no one. Not actors, not musicians, not the anonymous millions worldwide. Today we confront its global toll. Was it Alzheimer's? Or another thief of the mind? The brain keeps its secrets well. The silent epidemic: 50 million plus people live with dementia globally. Alzheimer's accounts for 60 to 70% of cases. Every 3 seconds, someone develops dementia. Alzheimer's Disease International, 2023. Economic cost: $1.3 trillion annually, greater than the GDP of most nations. Brief anatomy of the brain, plus little-known facts. Basic structure: cerebrum, 83% of brain mass. Left hemisphere: logic, language. Right hemisphere: creativity, spatial awareness. Unknown fact: the folds, gyri, and grooves, sulci, increase surface area. If flattened, it'd be the size of a pillowcase. Cerebellum, little brain, coordinates movement, balance. Unknown fact: contains 80% of the brain's neurons, more than the cerebrum. Brainstem controls breathing, heartbeat. Unknown fact: the only part of the brain a cockroach can survive without. Limbic system, emotion center, includes the amygdala, fear, and hippocampus, memory. Unknown fact: smells bypass the thalamus, triggering instant memories. Why nostalgia hits hard with sense. Shocking brain facts. Most don't know, 60% of your brain is fat. Myelin sheaths need lipids to insulate neurons. It burns 20% of your calories but is only 2% of body weight. Your gut bacteria influence brain function via the vagus nerve. Brain tissue doesn't feel pain. Surgeons can operate while you're awake. You lose 85,000 brain cells daily, but have 86 billion total. Little-known sleep brain facts. Your brain shrinks 60% during deep sleep to fit more cleansing fluid. Dreaming is trauma therapy. The amygdala processes fear memories at night. Pulling an all-nighter drops IQ by 15 points, worse than being drunk. The brain's secret night shift. Sleep's crucial role. 1. Creativity boost during REM sleep. Your brain replays and remixes memories, like a film editor, sparking eureka moments upon waking. Example: Paul McCartney dreamed the melody for Yesterday, and Walt Disney's futuristic visions. Dreamed of audio animatronics and Disneyland. His limbic system plus prefrontal cortex collaborated at night. Science. During REM sleep, your brain disconnects from logic, letting the right hemisphere run wild, hence surreal dreams. 2. The glymphatic system. Nighttime detox. During deep sleep, cerebrospinal fluid floods the brain, flushing out toxic proteins, like beta amyloid, linked to Alzheimer's. One night of poor sleep raises amyloid levels by 5%. Chronic sleep loss equals brain clogged like a dirty filter. 3. Sleep deprivation, brain cannibalism. Without sleep, Neurons overeat their own synapses, self-cannibalizing for energy. Remember, you don't need to be a koala, but even the goldfish sleeps. The Alzheimer's brain, dreaming dead, autopsy. Finding plaques of beta amyloid, toxic waste, clog the glymphatic system, blocking the nighttime car wash that cleans the brain. Result: no deep sleep, no creativity, no memory consolidation. Neurons starve and self-digest. This Alzheimer's patient's brain didn't just forget memories. The brain forgot how to dream. Here's the rotting proof. Shift workers show accelerated brain aging. When the brain is at rest, sleeping, glymphatic system. Toxic beta amyloid flushes out during deep sleep. No sleep? The brain drowns in its own filth. Symptoms and signs: the slow fade. Alzheimer's does not strike like a bolt of lightning. It creeps, first stealing names, then faces, then the very essence of self. For musicians like Ravel, it robbed the ability to compose, and prima ballerina Alicia Markova, whose later performances were haunted by lapses in memory, plus dancers, it erased the memory of choreography. Key features of Alzheimer's disease: pathology, marked by the buildup of amyloid beta plaques and neurofibrillary tangles, tau protein, in the brain. Brain changes, generalized brain atrophy, especially in the hippocampus and cerebral cortex, enlarged ventricles, and neuronal loss. Symptoms: early signs include forgetfulness and disorientation, progressing to severe memory loss, language problems, and loss of bodily functions. Blood work and diagnosis, ruling out imposters. The marker that will be beneficial to people over 60 is to check for apolipoprotein. APOE is a protein that plays a crucial role in lipid transport and metabolism, particularly in the brain. APOE is encoded by the APOE gene with three major alleles: allele 2, 3, and 4. The allele 4 is a major genetic risk factor for Alzheimer's disease and has been implicated in the development and progression of the disease. Before we blame Alzheimer's, we must rule out mimics: vitamin B12 deficiency, thyroid disorders, even syphilis. Blood tests check for these. Yet the true verdict comes after death, under the microscope. The APOE protein, a genetic betrayal? Here lies a clue: the APOE gene. Those with APOE4 have a higher risk, but not a death sentence. Why do some brains resist the plaques while others succumb? The answer may lie in the silent war between resilience and decay. Those with specifically the APOE4 variant is a significant genetic risk factor for late-onset Alzheimer's disease. Carriers having an increased risk of developing the disease, and those with two copies having an even higher risk. According to the National Institute of Aging, about 25% of people have one copy of APOE4 and 2 to 3% have two copies. Autopsy findings: the devastation within Hackman's brain. On autopsy, the Alzheimer's horror. Inside this brain weighed 30% less than it should have. And when we cut it open, the memories were literally erased. This is what Alzheimer's really does, revealed in Hackman's autopsy. Alzheimer's doesn't just steal memories, it physically eats the brain. This autopsy proves it. But how do we confirm this thief at the autopsy table? At autopsy, the Alzheimer's brain is a wasteland. Shriveled gyri, amyloid plaques like gravestones, and tau tangles strangling neurons. Yet not all damage is equal. Some retain islands of memory. Why? That's the enigma we chase. Changes correlate with progressive cognitive decline and cortical atrophy seen in the disease. Here is what the forensic pathologist will see on autopsy: severe cortical atrophy, particularly in the temporal and parietal lobes; shrunken hippocampus, responsible for memory formation; widespread amyloid plaques and tau tangles under microscopic analysis; neuroinflammation and loss of synapses and neurons; enlarged ventricles due to brain tissue loss. Brain health after 60, fighting the tide. Can we armor our brains? Emerging evidence says yes. Nutrition: Mediterranean diet, rich in olive oil, fruits, vegetables, nuts, and fish. Stay hydrated. Proper hydration supports optimal brain function. Limit alcohol. Excessive drinking can damage brain tissue over time. Exercise aerobic, 30 minutes a day boosts blood flow, walking or spending time with nature. Sleep 7 to 9 hours nightly to clear toxins like amyloid. While fish sleep, so do need rest to give your brain some rest. Stress management. Chronic stress shrinks the hippocampus. Try yoga, meditation, listening to music, talking to a trusted friend or a professional trained in mental health. Address those stressors, and it is okay to enlist a professional if you continue to struggle with sleep. Mental stimulation. Learn new skills. Musical instruments, languages, or crafts create new neural pathways. Puzzles and games, crosswords, Sudoku, and strategy games challenge different cognitive skills. Read regularly. Reading engages multiple brain regions and builds cognitive reserve social connection. Maintain relationships. Social engagement is strongly linked to cognitive health. Join groups, book clubs, volunteer organizations, or classes provide mental stimulation and connection. Health management, regular checkups. Monitor and manage conditions like high blood pressure, diabetes, and cholesterol. Avoid smoking. Smoking increases dementia risk and accelerates cognitive decline. Protect your head. Wear appropriate helmets for sports and take precautions to avoid falls. The brain is a garden. Neglect it and weeds take root. Caregivers, the unseen warriors. To caregivers, you are the unsung heroes. Self-care strategies. Schedule regular breaks, even 15 to 30 minutes daily doing something you enjoy. Accept help. Create a list of specific tasks others can assist with. Join a support group. Connect with others who understand your challenges. Prioritize your health. Keep your medical appointments and get regular checkups. Daily caregiving approaches establish routines. Consistent schedules reduce anxiety and confusion. Simplify communication. Use clear, short sentences and ask one question at a time. Focus on abilities. Identify what the person can still do and encourage independence. Create a safe environment. Remove trip hazards, install grab bars, and use nightlights. Managing challenging behaviors. Look for triggers. Note patterns around difficult behaviors. Redirect rather than argue. Change the subject or environment when tension rises. Stay calm. Your emotional state can influence the person you're caring for. Use validation. Acknowledge feelings even if the perspective seems irrational. Practical considerations. Learn about available resources, adult day programs, respite care, meal delivery. Organize medical information. Keep a binder with medications, appointments, and contacts. Plan for the future. Discuss advanced directives and long-term care options. Understand financial resources. Research Medicare, Medicaid, and other benefits. Technology assistance medication reminders. Use pill organizers or apps to manage complex medication schedules. Safety devices. Consider GPS trackers or medical alert systems. Telehealth options. Take advantage of virtual appointments when appropriate. Remember that caregiving is a marathon, not a sprint. Small adjustments to your approach can make a significant difference in both your well-being and the quality of care you provide. Resources exist. Start planning early if your loved one is diagnosed with cognitive decline. Alzheimer's Association, support groups 24/7 helpline. Respite care services, you also need a break sometime. Advanced directive planning. Not a bad idea to check with lawyers who deal with senior care, wills, and trusts. Remember, your endurance is a testament to love, ethics, and research. The brain's last gift. Should we use donated brains for research? The ethical line is thin. Consent must be clear, dignity preserved. Yet these cells may hold cures. A paradox, honoring the dead to save the living. Since the early 20th century, post-mortem brain examinations have provided crucial insights into this devastating disease, but raise complex ethical questions. Tissue repositories now employ strict de-identification measures, secure coding systems, and limited genetic data sharing. Robust informed consent processes ensure patients and families understand how specimens contribute to research. Alzheimer's is more than a disease, it's a mirror held to our humanity. How we care for the fading mind defines who we are. Until next time, listen closely. The Morgue Whispers. Poem by Anonymous. Still here. They speak about me in the past tense now, though I sit breathing in this very room. Remember how she used to bake those pies? As crumbs still linger on my dinner plate, I drift between two worlds, the now, the then. The faces blur like watercolors wet, yet feelings anchor me to solid ground. Joy, sorrow, wonder still remain intact. Some days I'm trapped inside a stranger's skin. My thoughts are like birds that cannot find their nest. But touch my hand and sing the songs we shared, and see how quickly I return to you. My essence lingers in these fragile bones, beyond the reach of what disease can claim. Behind these eyes that sometimes fail to know, I'm still the one you've always loved, still here,